According to a new report from the Grattan Institute, 2 million Australians who need dental care avoid or delay going to the dentist because they can't afford it. The report calls on the federal government to commit to a universal dental care scheme, and it also suggests a way forward. Stephen Duckett, who co-wrote the report, is in our Melbourne studio. But before we go to him, let's hear comments on this story, which have already come in after an online article by Olivia Willis. Welcome, Liv.
Hi, Norman.
So what have people said in response? You've got to have over 150 responses, I think, to your piece.
Yeah, it's been massive. It's very much resonated with people. So I think people are feeling pretty frustrated, and the common experience is that there's, people paying pretty hefty out-of-pocket costs for dental because it isn't, in most cases, covered. So Christine says last week she went in for an extraction. She got it half out and the dentist told her they couldn't remove it without a general anaesthetic, that it would cost $2,500. She said, what if I can't pay that? And they said, you'll go on a waiting list for about 18 months. She's in agony with a tooth half out, so she just had to pay it on the day. And that experience is pretty common. Cody says he needs braces to fix his teeth, but he can't afford it. Again, was told he'd go on a waiting list. That would take, again, about 18 months. And it's not just people who are kind of relying on the public system that are finding problems. So even people with private health insurance, for example. So if he said she needed a root canal, it would cost $650.
That's cheap for a root canal, actually.
Which is quite cheap.
But it's a lot of money.
Her private health insurance would cover $30 of that. So the experience seems to be people are pretty upset.
And where can people read your article, Olivia? After they've listened to the story?
That's right. They can jump on ABC News Online and find it in the health section.
Thanks, Olivia. Olivia Willis is the ABC Science Unit's health reporter. Stephen Duckett, welcome back to the Health Report.
Thanks, Norman.
I suppose you're not surprised by such comments?
Not at all. And you hear those stories all the time. And it's not surprising because more than half of the cost of dental care comes out of our own pockets. This is unlike prescriptions, GP specialists, where it's around 5-10%. And so you're inevitably going to have stories about people who can't afford it and the consequences of that.
Why is the mouth extracted from our healthcare system?
I think it's in the dim, distant past, Norman, that we need to look for the answer to that. So when Medicare was introduced, Medibank was developed in the late 1960s. Was obviously strongly opposed by doctors in the AMA, and the dentists too were not supportive. And so I think Gough Whitlam said, I'm not going to have too many fights. It's going to be hard enough to get Medibank and Medicare up. So let's just put dental aside for another day. And unfortunately, that other day never came.
And we've had things that have stopped and started, and there's now, I think for children and adolescents, and there's services obviously in the public sector from state and territory governments.
Oh, it's a complete mishmash and ramshackle arrangement. You never know. The schemes differ from state to state, and there are different exclusions and so on. And even if you're eligible in a state scheme, more than half the patients in state schemes wait for more than a year. And some of those stories Olivia reported to us just then. And
in the state scheme, the range of treatments is limited.
Absolutely, and the tragedy is if you have to wait for that year, something that your tooth might have, if you'd been there on time, your tooth might have been able to be saved, but a year later they take the tooth out.
Did you look at the knock-on effects?
Well, there's a huge amount of evidence, Norman, about the consequences of poor oral health. There's evidence about links to diabetes that go both ways. There's evidence about gut. There's evidence about cardiac. There's also evidence about employment, that people with poor oral health feel embarrassed about going to interviews and so on. And so there's lots of evidence about the consequences for people in addition to the pain that they might be suffering.
What would a national scheme cost?
We estimate that a national scheme would cost about $5.6 billion a year. This is a huge sum of money. We're not claiming that you could do this in one day. And what we're saying is you've got to say this is our goal and we want to get there over a 10-year period. I know it's hard.
But it is about the same as we spend on medical imaging. I mean, it's not...
It's not out of the question, and there's money to be saved in other parts of the health system and so on. So it's not an impossible goal. But one of the problems, Norman, is in fact, even if you announced it tomorrow, you couldn't do it because we wouldn't have the workforce to do it. So we've got to actually plan it and announce this is where we want to go. This is a long-term vision for Australia.
So we're not overproducing dentists the way we're overproducing doctors.
So there's been a massive increase in the number of dentists, and many dentists are now working part-time, the rate of part-time working amongst dentists is higher than the rate of part-time working amongst doctors and physios, for example. And so there is some spare capacity in the dental workforce, and we need to have more oral health therapists as well to be working in this field. And so you could certainly expand immediately. We think you should expand immediately to cover pensioners and healthcare card holders, the low-income people. We think you can do that, and we've shown that you can actually do that with the workforce we've got.
And you should be said that in the public sector, dental therapists do a lot of the work that you're used to dentists doing in the private sector.
Absolutely, and we're suggesting that the scheme should be encouraging oral health practitioners, both dental practitioners and oral health therapists, working at their top scope of practice, because you don't want to have people who are well trained to do the preventive and the initial primary procedures not doing them and paying a dentist to do them when they don't need to.
So take me stepwise through, you say that this is going to take a decade if you actually started now. What would you do? What would be the stepwise approach?
Well, the first stage should be to say, we're going to do it over a decade, but the first step would be pensioners and healthcare card holders. And what we're saying here is even then there should be a first step which says just expand it further in the public scheme to start with, because what we want to do is not have an open slather purely Medicare approach, but actually have a participating practice approach where dental practitioners would say, we're prepared to sign up to this scheme, and in exchange for signing up to this scheme, we're going to say there's going to be no out-of-pocket. So you'd immediately say there's no, if you're going to sign up, there's going to be no out-of-pockets. If you sign up, you say we're going to provide the data about what we're doing. So the funding agency, probably Medicare, would be able to compare the practices to see who's got a more preventive orientation, who's using evidence-based.
Do you think dentists will sign up to that?
Well,
we haven't had doctors signing up to that.
Well, this is a major expansion of the funding available, and I guarantee that the public schemes, the states would sign up to that. And I think
if the federal government's going to cough up, you mean?
Exactly. But and this would mean basically an end to public sector waiting lists. But I think there'll be private dentists who would sign up to that as well. Many private dentists are already signing up to the Child Dental Benefit Scheme, and we're suggesting the payment rates be roughly the same as the existing Child Dental Benefit Scheme. So we're confident that there'll be many dentists would be prepared to sign up to that scheme.
And the end point is what? An expansion of Medicare, a national health insurance scheme, or a separate dental health insurance scheme? We're
suggesting it should be what we're calling it is a universal dental scheme, because there are differences between Medicare and what we're proposing. We are proposing something based on participating practices. We are proposing a much greater monitoring, because we want to actually ensure that evidence-based practice is used. We want to ensure that we are using oral health therapists to the extent we can possibly use them. So it's not just a free-for-all, but a managed scheme which aims to actually, as efficiently as possible, expand dental care for all Australians.
So make up for, don't make the mistakes of Medicare around the second time around. Stephen, thank you very much for joining us.
Thanks, Norman.
Professor Stephen Duckett heads the health program at the Grattan Institute at the University of Melbourne.